Acupuncture is a treatment modality that's part of Chinese medicine that uses very small needles to influence the body's circulation and hormonal system and musculature. Well, acupuncture as part of Chinese medicine is part of a holistic health system. So at a certain point in time in the East, if you got sick, what you did was get acupuncture, took herbal medicine, maybe got massage, things like that. So acupuncture can help. My specialty is pain, so it's very good for pain, for depression, all kinds of things. I've treated everything from pain to depression to spiritual issues, anxiety, colds and flus, gynecological issues. I think the biggest misconception is people think it's going to hurt a lot, and it really doesn't. The needles are very small. It's not so painful because people associate needles with injections, and injections go into blood vessels, which are very sensitive to pain. Acupuncture needles are going into just bits of flesh, muscles, or skin, and it really isn't that sensitive to pain in those areas. Acupuncture, they both use the same system. There's a set of points of what you could, a type of anatomy, a way of looking at the body. Acupuncture is needles. You're puncturing the skin. Acupressure, you would either use your fingers or some other sort of blunt tool, but it's basically the same. It's just a matter of depth. At that level, it's more about the practitioner themselves than the treatment method. I've met some really amazing acupressurists or a master acupuncturist who almost never uses needles anymore. He just uses his fingers. I myself use my fingers a lot, but I like the needles because there's certain things you can do with a needle that you can't do with your hands. You can get deeper, you can get more specific. You can activate the muscle point the motor point on a muscle and get a certain response. I think a good practitioner uses both, in my opinion. I had a woman who came to me for back pain. She was in her 60s, and through the process of looking at her whole body, I found that a big source of the pain had nothing to do with her back. It was the emotional impact of these large C-section scars on her abdomen, and how she held her posture as a result of the shame of these C-section scars, and that caused her back pain. And so by identifying that and treating, having her help bring her awareness to that area and get over some of that shame, helped her with the acupuncture.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.